think for a moment about just the power of a simple smile. It's more than just an expression, right? It's about connection, confidence, a life lived with dignity. Today, we're diving deep into an organization that's literally giving that power back to children, giving them a fresh start with, well, incredible surgical care.
Yeah, we're talking about ABMSS, Akila, Bharatha, Mahila, Seva, Samaja. It's actually India's largest civil society organization doing this work. Their whole mission, it's focused on providing free and safe cleft lip and palate surgeries. And their core belief is really powerful. They believe every single child deserves a dignified life, a second chance. You know, tackling that lifelong stigma, the hardship these conditions can cause.
And the scale is just, wow, over 46,000 children across India. Their lives changed already. That's not just a number, is it? That's profound impact. So how does an organization even do that, achieve that kind of reach? And what does it tell us maybe about the bigger picture, global health, dignity, that sort of thing?
Well, their approach, it really stands out. ABMSS operates with a really comprehensive model. They've built this huge network, freely skilled surgeons, anesthesiologists, support teams too, all under Dr. Dushyant Prasad's leadership. He's the visionary there. It's not just about the surgery, you see. They're giving hope, confidence. Dr. Chaitra Vienanth, she's on the board. She put it really well. She said, "I am proud to champion access to safe, transformative cleft care that empowers every child to smile with dignity and confidence."
That really gets to the heart of it, doesn't it? Empowering kids. You mentioned the scale, but how do they find these children? I mean, many must be in really remote, underserved areas. They can't just be waiting for people to show up, surely.
Exactly, no. They are actively going out. ABMSS is really committed to reaching those underserved communities. They do it mainly through outreach camps, extensive ones. And what makes it work so well are these crucial partnerships they have. Partnerships with various state governments, especially through the Rashtriya Bal Swasthya Karyakram, RBSK. That collaboration means kids get diagnosed, get help in a timely way, even if they're far out, where specialized care is normally impossible to get.
Okay, so the partnerships and outreach are key for the reach. Impressive. But you mentioned comprehensive care. What does that actually look like beyond the surgery itself, especially for families who might have very few resources? How do you make sure that new smile leads to, well, lasting well-being and dignity?
That's a really important point. And it's where ABMSS truly excels, I think. Their care model is holistic. It goes way beyond the operating room. We're talking essential support like speech therapy, orthodontics is crucial, nutritional support, counseling for the families. It's vital. They even run a national cleft helpline, so families have ongoing guidance. And to keep standards incredibly high, they have these flagship programs. Skill drill for training surgeons continuously, and safety in the OT to maintain the absolute highest patient safety. It's about building a whole support system around that child and family.
Right, that deep commitment, the post-op care, it really elevates what they do. So with all this complexity outreach, holistic care, what's their growth been like over the last decade or so? Was it just steady or were there big jumps?
It's been an extraordinary journey, really remarkable. Dr. Ashish Shetty is the vice president. He pointed out that about a decade ago, the initial goal was maybe supporting 1,000 surgeries a year, just 1,000. Now, they're operating in 15 states. And treating nearly 5,000 cases every year. That kind of, exponential growth. It says so much about the need, obviously, but also how effective their model is.
Yeah, 5,000 a year now. That's truly inspiring. And it makes you think, this idea that one medical intervention can just fundamentally change a family's future. Amit Mirpuri, another board member, said it beautifully. A new smile can change a child's life and their family's future, and thousands of children now have that chance. So beyond the immediate medical fix, what are the sort of systemic shifts? How does something like this change a whole family's path?
It really creates ripples, doesn't it? Ripples of empowerment. It impacts social acceptance for the child, definitely educational opportunities, even economic stability down the line for the family. And ABMSS, now marking over a decade of this work, their mission keeps growing. They have a really bold goal now. They want to reach every single state in India and help 10,000 children every year.
10,000. Wow. So as you think about this, maybe a final thought for you listening, how might initiatives like ABMSS change how we think about humanitarian aid? Are we seeing a shift, moving beyond just, say, emergency relief to this kind of long-term transformative empowerment through very specialized medical care?
It's definitely something to consider, isn't it? How targeted medical help can actually be a profound engine for social change. Really powerful stuff.
It certainly gives you a lot to think about. You can find out more about this incredible life-changing journey online. See for yourself the difference that, that a smile can truly make.